What if a simple flower is the key to preventing moon face? What if a chemical derived from a flower could solve this dreaded side effect of prednisone? Wouldn't that be amazing? Well, this sage and rose are not the flowers that we're hoping for. Instead, we want Galega Officinalis, which is also known as French lilac or goat's rue. That plant has some amazing properties to it that in traditional folklore in France, they would give it to people who had sugar or honey urine, people who had diabetes. This miraculous, naturally derived treatment for diabetes comes from the French lilac, and it's called metformin, Metformin. Metformin can help prevent diabetes. But what does that have to do with prednisone? So they've tried a lot of drugs to help counteract the side effects of prednisone, and they've recently discovered that maybe metformin might help. So the moon face, the weight gain, where do they come from? They probably come from the sugar issues. Prednisone is a glucocorticoid, like glucose, and that means that the sugar is involved in the problems that prednisone is creating. So if we could find a medication or a natural substance derived from a flower that could help keep our glucose system in control, then maybe that would be the cure we need. So they did a study, and it was the highest quality level of study, a randomized, double-blind, placebo-controlled, and it was the gold standard. It was 4 weeks long in the country of Switzerland. And what they did is they gave people who were taking at least 7.5 milligrams of prednisone or more, and they were planning to take it for at least 4 more weeks. They said, okay, will you do the study? And they said, if they said yes, then they said, okay, here's some pills. And they were given a pack of pills that looked identical to each other. If they got this pack of pills, it was just a fake pill called a placebo. And then there was this one that had metformin actual in it. And each tablet had 850 milligrams of metformin. Now that's quite a big dose to start out with. Normally we slowly work our way up, but we'll get back to that in a minute. So they started out by taking 1 pill per day of the metformin, and then they went up to 2 pills a day. So in the morning and at night. And they did that for 3 weeks. So 1 week of once a day and 3 weeks of twice a day. And they were able to enroll 24 people into the metformin group and 14 people into the placebo group. And that is not as many as they were hoping to get. Unfortunately, their supply of drug was about to expire, so they couldn't add any more people. Even so, they were able to get a statistically significant result. That's pretty good because they didn't think they could at that small of a sample size. The dose that they started out of the prednisone was similar in both groups, but some of the people who ended up being in the placebo group ended up having higher doses over time. And so the placebo group actually had more exposure to prednisone, a total of 980 milligrams on average over that month versus 683 milligrams of prednisone over a month in the treatment group with the metformin. So that's a nearly 30% difference. They didn't find it to be statistically significantly different, but it was a little thing to be aware of when we're comparing the results at the end. So they were hoping that they would be able to detect a difference between the body mass index or the waist to hip ratio of weight gain, essentially from the prednisone. But they only did a 4-week study. And so I don't think that's long enough to detect a difference in the body composition. I think if they had gone for 12 weeks, they could have seen a difference, but 4 weeks wasn't enough to see a difference. Then one of the main things that holds people back from taking metformin is that some people get really bad gastrointestinal GI side effects like burping, farting, diarrhea, nausea, some people get constipation, but it's usually just that things aren't passing through the way they normally do. That's because it's a plant-based substance. But what was cool is they didn't actually see any difference. That the people who got the fake drug and the people who got the real drug, they had the same amount of side effects. So that's great. Like, there's not any greater risk to be taking metformin. So what they did see, what were the good results they saw? Here is the fantastic news. They saw 3 things that were statistically significantly different between the treatment with metformin and placebo group. They found that preventive metformin treatment is superior to placebo with respect to glycemic control. And by the way, I forgot to mention this at the beginning. The people who were taking this diabetes drug did not have diabetes. So they shouldn't need a drug unless they were taking prednisone, okay? So they discovered that testing the 2-hour glucose area under the curve, it was better for people who were taking metformin. This HOMA index, HOMA, is a measure of insulin resistance. So that has to do with our blood sugars. And it was better for people with metformin. And finally, the fasting glucose and fasting insulin were better in people with metformin treatment. So that shows that the metformin is helping to counteract the glucocorticoid-induced diabetes changes. And that is fantastic news. How might it be doing this? Well, metformin itself, it has lots of ways it probably works, and they don't know for sure exactly how it works. They do know it has anti-aging properties. It helps prevent cancer. It helps prevent diabetes. It helps treat diabetes. It helps with weight loss. It does all sorts of awesome stuff. And it might be because they said glucocorticoids influence the AMP kinase signaling pathway in opposite ways, and that metformin effect is able to override the cortisol effect. So prednisone's causing this, and metformin's helping to counteract it. So that's awesome that we might have a way to reduce harm from steroids. So weight gain is one of the most common side effects from prednisone, and this is potentially going to help to prevent that. One of the worst side effects as far as long-term irreversible is osteoporosis. And they haven't actually done a study yet in humans, but in rats, they were able to show that metformin prevents osteoporosis in rats. So that is 2 of the worst side effects that people complain about that potentially metformin might be counteracting. And normally doctors don't prescribe metformin unless you have diabetes. And so you just go up to your doctor and say, hey, I want some metformin. Maybe. I mean, there's not a lot of risk involved. Like, it's a great drug derived from nature, and it's actually super cheap. If you go to your pharmacy, it is one of those medications that is fantastic, works super well, helps people like save lives with diabetes, and doesn't cost a lot of money. It's like the best of all of the worlds. And so you can ask your doctor for metformin. And I found some potential other sources that you could get it if you're having a hard time making an appointment with your doctor to get it, where you can make a telemedicine appointment with an online doctor that they can help you get access. So just click the link below to see where I recommend getting metformin to help treat your prednisone side effects, because it's a prescription medication that may be the cure that we need. Well, not necessarily a cure, but the preventive that we need to help with prednisone causing high blood sugars, and potentially it can help with the osteoporosis as well. So this is fantastic news that is coming out with emerging studies. Hopefully we'll learn more in the future with longer studies and more details. Signing off as Dr. Megan, your prednisone pharmacist.